Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can you get the flu in summer? You can get the flu in summer, but it's not very common. The influenza virus is more active in the fall and winter in the United States. /r/n/r/n. However, in the aftermath of the COVID-19 pandemic, worldwide flu patterns have been less predictable. This has led to an unusual rise in summer flu cases. /r/n/r/n. Still, a summertime upper respiratory infection is likely something other than influenza. COVID-19, respiratory syncytial virus, RSV, Lyme disease, bronchitis, and pneumonia can cause flu-like symptoms like fever, headache, congestion, and fatigue. /r/n/r/n. This article discusses summer flu and flu-like illnesses. It explains why you may get influenza in the summer and lists other illnesses that cause similar symptoms. It also provides tips for managing cold and flu symptoms in the summer heat. /r/n/r/n. The influenza virus is always circulating in some part of the world. /r/n/r/n. In the United States, flu season traditionally runs from October to April and peaks between December and February. In the Southern Hemisphere, influenza is typically active from May to September. /r/n/r/n. However, the COVID-19 pandemic disrupted global flu patterns, making worldwide flu activity less predictable. /r/n/r/n. Only time will tell if flu seasons will return to standard pre-pandemic patterns. Until then, getting the flu in the summer will likely be more common than in the past. /r/n/r/n. Get our printable guide for your next doctor's appointment to help you ask the right questions. /r/n/r/n. Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n. Thank you. Form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. Symptoms of influenza are the same in the summer as they are in winter. They include /r/n/r/n. Flu symptoms typically last between 3 days and 2 weeks. People can be contagious the day before symptoms appear for up to a week. However, it's most contagious during the first 3 or 4 days of symptoms. /r/n/r/n. If you suspect you have the flu, contact your healthcare provider. Prescription antiviral medications can shorten the duration of the flu. /r/n/r/n. Flu-like symptoms in the summertime are often caused by something other than influenza. These flu-like illnesses can cause body aches, fever, headaches, and upper respiratory symptoms. /r/n/r/n. The main difference between the flu and other viral respiratory infections is the onset of symptoms. Influenza symptoms tend to occur rapidly over the course of a few hours. Other respiratory infections, like the common cold, gradually build up over a few days. /r/n/r/n. Other viruses or bacteria can cause flu-like summer illnesses. Mosquitoes and ticks can also transmit infections with flu-like symptoms. /r/n/r/n. Summer flu-like symptoms are most likely a viral or bacterial infection. Possible common causes include /r/n/r/n. Flu-like symptoms in the summer can also be caused by a mosquito or tick bite. Insect or vector-borne illnesses are often linked to specific regions. /r/n/r/n. Let your healthcare provider know if you have flu-like symptoms and have recently traveled abroad or within the United States. Insect-borne illnesses that can cause flu-like symptoms include /r/n/r/n. Your symptoms, along with your travel itinerary, can help your healthcare provider pinpoint a diagnosis. For example, /r/n/r/n. If you suspect you have influenza, contact your healthcare provider. Antiviral medications can help reduce the severity and duration of symptoms and may prevent serious complications. Antivirals must be started within the first 2 days of symptoms, so don't delay. /r/n/r/n The following factors may put you at higher risk of flu complications. /r/n/r/n If you or your child develops flu-like symptoms and are at high risk of complications, contact your healthcare provider for guidance right away. /r/n/r/n Other symptoms that should be evaluated by your healthcare provider include /r/n/r/n Seek emergency medical care if you or a loved one has any of the following symptoms. /r/n/r/n Additional symptoms in children that warrant immediate medical care. /r/n/r/n The summer heat and humidity can make cold and flu symptoms feel more miserable. While symptoms can be managed with the same remedies you would use at other times of the year, summer presents some unique challenges. /r/n/r/n Finding a comfortable air temperature can be hard when you have a fever in the summer. /r/n/r/n If you have air conditioning, aim to set it just cool enough to keep you from sweating but not so cold it triggers chills. Shivering will raise your core body temperature, making a fever worse. /r/n/r/n Air conditioning will also remove the humidity from the air, which can dry out congested sinuses and make breathing difficult. It may help to run the humidifier while you sleep. /r/n/r/n Keeping hydrated will help relieve congestion. Drink plenty of water and other fluids. Suck on ice pops or ice chips. /r/n/r/n Common go-to cold remedies like tea with honey and lemon or chicken broth may not be appealing in the heat. Try them at room temperature or cool instead. /r/n/r/n Electrolyte drinks, like Gatorade or Pedialyte, can also help keep you hydrated in the heat. /r/n/r/n To keep your sinuses hydrated, use a saline nasal spray, rinse, or neti pot and run the humidifier. /r/n/r/n Summer flu symptoms can often be managed with over-the-counter cold and flu treatments such as /r/n/r/n In some cases, prescription medications may be needed. These may include /r/n/r/n Summer flu cases have been on the rise in recent years. Global flu patterns have become less predictable following the pandemic. As a result, more people get the flu in the summer than in years past. /r/n/r/n Still, flu symptoms in the summer are more likely to be something other than the flu. Bronchitis, the common cold, COVID, and other viruses can cause flu-like symptoms. You can also get a flu-like illness from mosquitoes and ticks, such as Lyme disease, malaria, or Rocky Mountain spotted fever. /r/n/r/n If you suspect you have the flu, contact your healthcare provider for advice. People at high risk of flu complications may benefit from antiviral medications, which must be started within 2 days of symptom onset. /r/n/r/n Flu symptoms can feel more miserable in the summer heat. Drink extra fluid to stay hydrated. Air conditioning can help you to feel more comfortable. If you have a fever, set the AC so it is cool enough to prevent sweating but not so cold you shiver. /r/n/r/n OTC cold and flu medications can help to relieve summer flu symptoms. If symptoms persist or worsen, contact your healthcare provider. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.